Again, thank you everybody for joining. Today's webinar is on the role of primary care in reducing the risk of caregiver burnout for better patient care. Just for a bit of a housekeeping, everybody's microphone is going to be muted as well as your video will be off. But if at any point in today's session you have a comment or question, please feel free to put them in the chat box. Either one of us will answer it directly, or we do have a dedicated Q&A session at the end where we can, where one of our speakers can answer your question. As well as today's session is recorded, so we will send out the recorded video as well and the PDF of the slides, as well as a summary of today's session in a follow-up email. So stay tuned for that. So even if you don't, if you can't stay for the whole day, we do have the whole session being recorded. So we have a few seconds left, but I'm going to get started because we do have a few packed agenda. So I'm going to ask Lisa to go to the next slide. So I want to start with a land acknowledgement. So this picture is just 5 minutes from my house. I love taking a walk along the Humber River Water Trail. It's such a peaceful spot, so beautiful. But while I'm going for a walk there, it's also important for me to acknowledge the history here. This area has been cared for by the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples for many, many generations. And so I'm very grateful to be able to enjoy this beautiful space and to honor the Indigenous people's connection to the land. And I invite all of us here to also acknowledge and take a time to learn about the land in which we are situated today. Next slide. So for today's session, we have we're going to get started with an overview of the caregivers in Ontario, as well as their essential role in our healthcare system. We'll talk about why caregiver support is essential and is important in primary care. We'll talk about health promotion in action, different practical strategies in which primary care teams can take, as well as a caregiver support in practice at Elliot Lake Family Health Team and the support that they're doing over there. And lastly, we'll talk about different ways in which primary care teams can leverage the Essential Care Partner Support Hub and ways in which our team can support primary care teams when it comes to caregiver support. Next slide. So hi, everybody. Again, welcome. My name is Fardosa. I am the Knowledge Exchange Lead for the Essential Care Partner Support Hub. And I invite all of us to please introduce yourself if you feel comfortable with possibly your name, your role, and the organization that you're coming in from. This will just help us get to know each other in the chat box. Next slide, please. So for today's presenters, we have Alison Kilbourne, Manager of the Essential Care Partner Support Hub here at the Ontario Caregiver Organization. We also have joining us today is Jess Rogers, Chief Executive Officer at the Association of Family Health Teams of Ontario, Nancy Ewen, Executive Director at Elliot Lake Family Health Team, and also Janine Nurlos, Implementation Lead at the Essential Care Partner Support Hub here at the Ontario Caregiver Organization. We do have a packed agenda, so without further ado, I'll pass the floor to Alison Kilbourne, who will be talking about caregivers in Ontario and their essential role in our healthcare system. Over to you, Alison.
Thanks so much, Fardosa. We can go to the next slide. If you're not familiar with us, the Ontario Caregiver Organization is a charitable nonprofit organization formed in 2018. We provide direct caregiver programs and services and also promote public awareness of the caregiver's value and contribution across the health system. To do this, we seek input from caregivers themselves to ensure our initiatives are in alignment with their needs and priorities. And through our efforts with health system partners in particular, we engage broad stakeholders and organizations in an effort to create a more caregiver inclusive experience across our healthcare system. The work that we do with my team at the Essential Care Partner Support Hub is part of this pink bubble of system outreach and collaboration. And you'll hear more about that later in this webinar from Janine. However, before I provide a bit of an overview of caregivers in Ontario, I thought it would be helpful to just touch on some of the direct programs and services we do offer at OCO. Next slide, please. So our direct programs and services at OCO are for caregivers themselves. They are all free of charge. This provides just a high-level overview, and I wanted to just touch on a couple of pieces. One of our key connections is the Ontario Caregiver Helpline. This is really important because it connects caregivers to support for themselves, as well as folks they're caring for at a local level. So connecting folks with local community supports, and this is really important if, as a provider, if you're not even sure what's available, this is a great place to start. Some of the other supports that we offer at the Ontario Caregiver Organization are our one-on-one peer support program, as well as our peer support-led online support groups. These are incredibly popular programs, and caregivers find a lot of support through this peer mentorship model. We also provide frequent education opportunities for caregivers through our monthly webinar series. These are live and recorded, and all the past webinars can be found on our website. And our Scale program is actually just wrapping up. It's in its last couple of weeks of its 8-week program. This really targets caregiver mental health and well-being, providing education tools and a support group or a small group or one-on-one counseling opportunities to caregivers as well as part of that. All of these programs and services are available and accessible through our website to Ontario caregivers across the province. One of the other pieces that's not highlighted here are many of our tools, resources, and toolkits, and those can all be found on our website as well. But now I want to dive in and just provide a bit of a bird's eye view of who we're talking about when we're talking about caregivers in Ontario. So these numbers are reflective of the caregivers in Ontario as of our Spotlight report that just came out in December 2024. So there are approximately 4 million caregivers across Ontario, including young caregivers right now. That number is expected to increase, and I'll speak to that shortly. But when we think about caregivers, these are crossing all age groups, and you'll see some of the kind of larger numbers in the middle age bracket, and I'll speak to that in a moment. There's also a fairly even split in terms of gender divide, and so we can see that caregiving is affecting everyone of all sorts across the province. Next slide, please. So who are caregivers and who are they caring for? When we look at caregivers, oftentimes we see that they're most of the time caring for one person, usually an older family member, friend, or oftentimes a parent. And one of the things I wanted to highlight on this slide are that most folks are in that sandwich generation point, and that also correlates with the folks who are working caregivers. And in fact, what that looks like is probably that many folks on the call today are also caregivers themselves, even and may in fact be in a role of double duty caregiving, where you are caring in a personal capacity, but also actually in a formal caregiving role in your professional life. So this provides a kind of bird's eye view of what are some of the relationships and frequent kind of interplay between caregivers and the people they're caring for across Ontario. Next slide. What we do find overall and through consistently comes through our Spotlight reports every year are that caregivers are struggling. 79% are feeling so tired that it's difficult to get things done. Just over 70% are feeling so burnt out that they're not sure how they're going to continue, but they have no choice but to keep going. And similarly, 75% are really concerned that they're not going to be able to handle those caregiving duties moving forward. So we're really hearing at a fairly consistent and growing level year by year that caregivers are struggling. And so that's really important when we think about the context and what we're about to talk about today. Next slide. This is also really important when we think about changing demographics and what this looks like now with 4 million caregivers and also for the future. So looking at Ontario's population, and the expected increase in folks living with chronic disease, we are looking at an unprecedented demand on healthcare and an increased pressure on family caregivers. We are looking at a likely increase of 2.5 million caregivers in the next 5 years. So, because that means that by 2029, more than 9 million Ontarians are expected to be in a position of needing care. And that care doesn't just come from the formal healthcare system, but most of it, in fact, comes from family, friends, and neighbors who are supporting people living in their homes. Ultimately, what is really important and what I want us to keep in mind throughout this webinar is that caregiver well-being impacts patient health outcomes. When caregivers aren't well, patients aren't well either. In particular, caregiver mental health has been found to have a direct impact on patient clinical and mental health outcomes, not surprisingly. And when caregivers don't have the capacity to care for their person care that they are caring for, this can lead to a number of things like increased use of emergency and acute care by patients. So that link between caregiver health and patient health is so important to understand. And it's so important to keep in mind when we think about what we're hearing from caregivers about how they're not doing well right now. So we need to think about this not only for the caregivers who are caring now, but also for the caregivers who have yet to come. How can we set them up to care for people in their lives better? How can we reduce the risk of burnout in order that they can keep caring for the people they want to be caring for? I'm really delighted now to hand it over to Jess Rogers, CEO from AFHTO, to really touch on why this is so important in the context of primary care. Over to you, Jess.
Thanks so much, Allison. Thank you so much for having us here today. It's such a pleasure. This is a critical topic for us at the Association of Family Health Teams of Ontario. Just a little bit about who AFHTO is. So we represent over 190 primary care teams. So that's family health teams, nurse practitioner-led clinics, and others. It's really great to see so many of our teams actually on the call today. And so we care for about 3.5 million Ontarians. And of course, that number is growing as you are following along with the news around the expansion of teams to get more Ontarians linked up to teams. So I wear that hat today. I also wear the hat as a caregiver. I also wear the hat as someone who's worked in a health charitable space where working directly with people with lived experience and their caregivers. And I think one of the pieces that we wanted to frame up as AFHTO, before we get into some of the detailed work that Elliot Lake has been doing with OCO, was just primary care is a strong and passionate part of the health system. And so the language that's being used around the foundation of the health system is just so critical because that's where the relationships are longitudinally, ideally, right? It's comprehensive care. And so our teams get to know not just the individual, but their families, their neighbors, the people that are caring for them, whether they recognize themselves as caregivers or not. And that's just such a critical place for us to make sure we're focused because for all the reasons that Allison has just said, and we can go more and more into the evidence that shows the cost actually that the cost savings, knowing that there's that 4 million caregivers that are providing a lot of care that the system, the community, the social supports don't have to provide. And so there's a very strong economic model here for governments to recognize that role of caregivers and make sure that if we're looking at expanding teams in primary care, how do we also ensure that we're providing the right resources for scaling and spreading work like that OCO is doing, or that the teams are doing, or that the communities are doing, to make sure that we don't have that burnout happen with caregivers, that there is a greater recognition early enough on of the role that different people are playing to support a patient, because they are a vital part of our care teams, and oftentimes not always remembered. I think it's changing. We certainly are seeing that. I'd love to hear comments in the chat. Many of you, it looks like you wear this hat. So I think I've certainly seen over the past 8 to 10 years more and more of that language being used, more recognition, but there's a lot more that we can do. And so as we look at um, the work that OCO and Elliot Lake's about to talk about, it might not be exactly what your team looks like or exactly what your experience is, but certainly there's a lot that I think that can be taken from asking the question around how can we help people better acknowledge and recognize themselves as caregivers? It's very difficult to design and roll out programs where the very people you're trying to target don't recognize themselves as caregivers, right? So even sometimes using the term caregiver can be a challenge. And so think about the ways that these programs, these tools, these resources could be applicable for you. And again, these are the types of things that we need to collectively be advocating for, so that we have economies of scale, that we're not having to recreate things in each of our different teams or in each of our different communities. And that's the role that I see AFHTO and OCO being able to play together, and as we move forward in a stronger partnership. And I just wanted to acknowledge the work that Elliot Lake and Nancy have done in leading the way. And so with that, again, thank you so much for having us here. I look forward to the discussion, and I'll turn it over to Nancy to get into some of the details.
Good afternoon. My name is Nancy Ewen, and I am the Executive Director for the Elliot Lake Family Health Team. Is it my turn to go on?
I think, Nancy, we will start with a brief component on OCO, and then we will be right over to you.
That is perfect. I'll be ready and waiting.
Amazing. So we will hear from Nancy shortly, and she's going to talk about some of the actions and strategies that we've identified in practice. But really briefly, I'll introduce myself. My name is Janine, and I am an implementation lead here at the Ontario Caregiver Organization. And I primarily work with primary care organizations. So now that we've covered the importance and need for caregivers, which we heard from Allison, as well as from Jess, I'm going to provide some actionable strategies to make this a reality in your setting. And before going into that, I think it's really important just to acknowledge that there are a lot of barriers. Without a doubt, I think the evidence and information provided today really does showcase the need and importance. But also, there are so many challenges to make this a reality. So, on the caregiver side, caregivers are typically focusing on the person they are caregiving for. They might be unaware of the supports available, and they're going to think about the support for themselves last. I also really like to acknowledge that caregiver identification has to happen on the caregiver side as well. And you might be in the position where you are a person for someone, whether that's a friend, a neighbor, mother, father, son, whatever your role is, you feel that first, but you have to have that, recognition. Hey, I'm a caregiver too. And on the other side of that, we also have healthcare providers. They might feel ill-equipped to support caregivers, which could just be the lack of available knowledge and resources in the community. They have limited time, sometimes already for patients, let alone caregivers. It can be difficult understanding information around privacy and consent legislation, and as well just apprehension around, what expectations the caregiver might have and what difficult situations should arise. So on the next slide here, in response to that, we have some strategies that we have identified through literature, but also working with primary care organizations over the past year. So we have a few here displaying caregiver information in high visibility areas, education for your team, how to support and embed caregiver touchpoints in practice, as well as quality improvement plans. So I'm going to dive into just a little bit of detail about each of these. But here we have, over the past year, kind of seen this reiterated need for providers to support caregivers and also for caregivers to recognize themselves as caregivers. And for me personally, I've really seen this as a bit of a health promotion strategy where that work doesn't necessarily need to happen in an appointment, but can be done in high visibility areas. So a few of the primary care teams that I've worked with this year have created PowerPoint presentations that can rotate on TVs, or they put up posters near parking machines. So this has been a way to distribute material and get the word out about caregivers in other areas outside of appointments. So not only can our resources be used in appointments, which is absolutely needed, but it can also be used as a health promotion tool. And most importantly, these can really be adapted to any setting and any location that's helpful. On the next slide, another really key one has been education for teams on the importance of supporting caregivers. It's so great that everybody in this room has some background knowledge on that today, or maybe in your personal life, personal experience, but really bringing awareness to the role and importance that that caregivers play in primary care. So, this can be important for smaller teams. You might have one team at your organization that might really benefit from this information, but your entire organization could really benefit as well. And this helps to build a culture of caregiver inclusion. So this strategy can occur at all levels. And when I say that, I don't even just mean for people working at an organization. This could be for patient advisory committees, which are sometimes composed of community members. It could be for providers, but also administrators who are working different types of roles, including sometimes database and evaluation. So important to note here, we have done this work in person and virtual, and we can really tailor sessions to your needs. From grand round sessions that are sometimes just 15 to 30-minute presentations, or like hour-long workshops. We've done this in a variety of settings and really have gotten positive feedback that this has assisted teams with just understanding the role caregivers play and how it might help them in practice. I will next move on to the role of just embedding caregivers into regular touch points. So while we can see that health promotion can happen in high visibility areas, or it can happen in team education, it's also great if this can happen in appointments. Really good times to identify this could be change in status, change in family, any sort of change that's happening. And, you can provide just helpline information. So, our 24/7 line where people can phone in, or we also have like caregiver screening tools adapted for primary care. And this can support with a needs assessment for what a caregiver might need at that time. So we have a range of tools that are available. And, in terms of what we can practically do is, yes, we can do education with your team, but we can also mail in sort of mini cards which outline our programs and services, our helpline or our assessment tools. And these can be available for your team to use in practice, or we can also offer online or virtual options as well for that. And for our last strategy here, I think when we're starting to think a little bit longer term, how do we consider caregivers in quality improvement plans? So if we're really digging into caregiver inclusion in your setting, you could think about how caregivers could be on or part of quality improvement or strategic plans. So this year, I have sat on another of working groups dedicated to improving caregiver inclusion in primary care settings. We worked through those health promotion strategies, conducted trainings, added sections on the website, and are now taking steps toward an organizational assessment. So, whether it's, someone from our team who's assisting your organization, or maybe you have caregivers themselves leading some of this work, or champions at your organization, just really thinking about how, when we're thinking strategically, can caregivers be included in that plan? I am now really pleased to pass it off to Nancy.
Good afternoon, everyone. My name is Nancy Ewen, and I am the Executive Director for the Elliot Lake Family Health Team. If you could push to the next slide, please. So we partnered with Ontario Caregivers Organization last year. Results were immediate and they were positive. In fact, our caregivers met here on site yesterday, and we always know when they've been here because boxes of Kleenex were all around the table, and the table changes lives. It's amazing to watch. Next slide. So Elliot Lake, if you haven't heard of it, is about 6 hours northwest from Toronto. We are right in between Sudbury and Sault Ste. Marie, about 2 hours either way. Most of our patients go to either one for referrals, specialists. And we're 30 kilometers into the wilderness off of the Trans-Canada Highway. So we are a rural community with its own challenges in healthcare. Originally, we were a mining community back in the 50s, and in the mid-90s became a retirement community. Our population, you can see on the slide, is close to 12,000. That was from 2023, and it remains about the same now. We are, most of our patients are low income. They have multiple comorbidities, including mental health and addictions. So it's never an easy appointment when we have our patients coming in. And you can see the median age is now 61 years. That has gone down. We're getting a little bit younger. For many years, it was 64 was the median age. So it's nice to see we're getting a little bit younger in here. Next slide, please. So caregiver burnout is prevalent in our community, and not just those caregivers who live here in our community, but we have many who are advocating for their loved ones from afar. We have adult children or siblings who call and try to get information about their parents or family members that cannot manage on their own or find supports to help them through. And in many cases, our caregivers need care themselves. So they're very, very sick individuals. I have one example of a gentleman here in town who he is looking after his wife who has MS. She has recently broken her hip. He himself requires a liver transplant and has recently discovered a heart issue. He requires frequent travel to London, Ontario, which is about 8 hours away. There's no one to look after his wife if he goes. There's no one to drive him to his appointment or get him home, or process the information that he's finding out in his appointment. The end result, he will, and he has at times denied his treatment to ensure his wife is okay. So this is the normal that we're seeing here. And caregiver burnout looks different for everyone. It results in physical, emotional, and mental exhaustion. We see examples of it every day. When we were approached by the OCO, there was no hesitation. The path was very clear because we could easily identify the caregivers that needed help the most. Myself, I am a caregiver as well. I'm the primary caregiver for my 85-year-old mother. I work in the healthcare system and I feel completely lost most days in trying to get some help for her. So I always wonder what is happening when someone isn't connected to the system the way that I am. And in fact, she's texting me at this moment. I have a neighbor going over to help her. It's never ending, but I wouldn't change a thing. Next slide, please. So OCO Champion, what does the partnership look like from our end? I cannot stress enough the importance of having an OCO champion who is already on your team. Our OCO champion is our systems navigator, Ashley. She has worked with our patients and in our clinic for more than 10 years. She knows our physicians, our allied health team, and our community very well. With respect to identifying caregivers, she's responsible for our hospital discharge. And so she calls patients on a very regular basis. She gets to know whether they have care set up or if someone is there for the patient. She has also spent the last 10 years as our OTN coordinator. So she had firsthand experience with patients who were coming into the office with their caregivers. She is our biggest advocate for this program and a true OCO champion. I have to credit her for coining the phrase. When I asked her what was instrumental to the success of this program on site, she said quickly and without hesitation, a champion. She has partnered very well with Stephanie, who works with OCO and comes by our office frequently. It's just been such a marvelous program. Next slide. So benefits to patients. The initial reaction of the caregivers involved here was surprise and shock. There is a stigma around seeking help. They feel inadequate. Caregivers naturally put themselves and their needs last. So they were very surprised to learn that this help was for them. And it took a little bit of explaining in some cases that this was for them and not their patient and their loved one. I have heard from family members of the caregiver receiving support. So in essence, the caregiver to the caregiver, the benefits of this program, how the caregiver is feeling the relief from the support of this program, and relief in the form of being able to speak with others who share the same stresses. You don't realize that there's others out there and that they're feeling the same thing. The feedback has been overwhelmingly positive from all affected persons. And even here, seeing them yesterday on site, there's laughter, there's tears. It's pretty amazing to see in action. Next slide, please. So benefits to healthcare, benefit overall, our patients are still receiving the attention they need, but they're better equipped and able to cope. I cannot recommend this program enough. My hope is that we continue this journey for as long as possible because I can see the goodness coming from it. And to that, I'd say the end for me. And to thank you for everyone. Thank you to everyone who has organized this webinar. It's very valuable information, and I really appreciate being part of it.
Thank you so much, Nancy, for sharing all of that. I know I'm feeling inspired, and I even know about the work you're already doing, so I hope others are feeling the same way right now. But now I think Nancy's really talked about the importance of collaboration, and we're just gonna kind of share a few ways that, that might happen for you or your organization if you're interested. So, I am really grateful to be part of the Essential Care Partner Support Hub. And I think what's most valuable to me is the three pillars that we operate under, which is identifying caregivers, including caregivers, and supporting caregivers. So, we keep those three pillars at the center of our work, no matter what we're doing. And we do find it provides a lot of value. That being said, we have four buckets of resources that we provide to people. And that first one is learning events and education. So you're all here today, and that is a learning event or education. We also have tools and resources. We provide collaboration, guidance, and support, as well as connect caregivers to support. So those are the four main buckets of work that we do. These are foundations to the work in our design, and I really want to highlight here new tools, resources, and support. So those four strategies that I discussed today and Nancy discussed happening in action have been created into a tool, and we have called that Health Promotion in Action, Simple Steps to Connect Caregivers to Support in Primary Care Settings. So this is one of many, many resources that we have available on our website and also that we can send and share with you. And we have that alongside posters, postcards, and toolkits. So everything from toolkits, which is I'm a caregiver toolkit, and we have several adaptations of that as well for different populations and languages as well. And most importantly, I think is although I'm the implementation lead for primary care, we also have implementation leads who focus on home care, hospital, long-term care. So when we are doing work together, I'm really able to work with other people on my team. We all work together to learn from one another. So, if there's been a need for a resource, it's very likely that potentially a resource has been developed for a hospital setting, and we can use those learnings to either inform or create and tailor a new resource. So we're really able to build off those learnings when working with one another. But I am very excited that we will be launching this new health promotion and action resource today. Moving on to resource packages. So if you are interested in anything that we have discussed today, we would love to get started with you, and that can be as simple as a resource package. So that includes some of the toolkits I just mentioned, which again are available in adaptations, our posters, which can be posted places, and also postcards for providers that can be used in appointments as well. So to get started today, I think we'll have that email again available at the end of our presentation and in the chat, but feel free to reach out to us, and we are happy to send you some resources both in print and digital. And, the last main item I wanted to cover today was our learning collaborative. So we had a caregivers as partners in care learning collaborative, and that has really emerged as a cross-sector learning. And that is now the learning collaborative. So there's a QR code where you can register there. And about every 6 weeks, we come together and meet with a variety of cross-sector partners, and we talk about issues or challenges or examples or wins, all related to including caregivers in healthcare. So this can be everything from caregiver ID and implementation. So some places have badges, how teams have built a culture, and just enabling this beyond COVID. So it's a very interactive group where everybody comes and learns with one another. I kind of love it because it's informal, but also like very helpful as well, where we really do feel like a community and can learn from one another. And just as I end off here before a Q&A, most importantly, I just really hope you walk away with a message that we can tailor our support to your needs. So whether it is just sending a resource package, maybe it's developing a new resource for a program, we're really here to support you where you are at. So thank you all for listening, and I'm going to pass it off to Fardosa to conclude us off here with the Q&A.
Thank you so much. I'm going to ask all of our presenters to be on video as some of the questions might be related to them. But the first question is, and I encourage all of our participants here today to pop your question in the chat. I do have a question here from Eileen, and I think Nancy touched on it a little bit. But it's like, how do you convince other caregivers, primarily family members, that outside care is required? I know you touched on it, that feeling of guilt and feeling of inadequacy. Do you have anything else to add?
I know that we have had that struggle here because people don't realize that they need the help. It's a matter of having the right person on your team who can say it in a way that makes it real and is not, I want to say the word insulting, but it just drives the message home to the caregiver. And if they're not ready to hear it now, maybe they're ready to hear it later. So give them the information and keep the lines of communication open, because it's very hard and you don't often identify yourself as needing help.
Yeah. Thank you.
Yeah,
And I
Fergus,
think,
if I can jump in and add to that, I completely just want to echo Nancy's last point around like the follow-up later piece. I think what we found is that it's oftentimes not going to be one conversation that's going to be the convincing piece, especially if someone is reluctant to, for many good reasons, to accept formal support. And I think that that's actually one of the kind of key reasons that a kind of prevention approach and a prevention mindset is so important. So those kind of early questions and check-ins to say, hey, how are you doing, need to happen probably 3 or 4 times before someone's actually willing to speak up and say, I'm not doing great, or B, actually be open to hearing what might look different, or might there even be supports available for me. But if no one's even opening the door to do that, then that opportunity is lost. So so I think that kind of like easy like check-in with folks is so central to starting those beginning conversations to have someone eventually, if they are reluctant, to accept care later on.
thank you, Allison. I saw a hand up. I think it's from Amandeep. Just like how can she connect, or how they can connect with getting started. So if you're interested in the Essential Care Partner Support Hub, Janine, our lovely implementation leads, can definitely connect with you. So please feel free to email us and we'll definitely connect you. I have a comment from Cheryl here. I found that adults don't start with the question, they want to comment. Yeah, definitely. I have a question from Roxanne. We have issues with enrolling caregivers to the program as they are already doing a lot and they don't know why they would need to do all of these steps. So essentially, how do you propose to answer this?
It's
Anyone else?
Allison. Maybe I'll jump in. I think Roxanne is speaking to like a formal essential care partner program in a hospital setting, if I understand correctly. I think that again, these are conversations around early conversations to understand and be able to explain how a formal program or a formal recognition can help caregivers understand the benefit of being formally and recognized and included, and then connected with supports. And sometimes that conversation maybe needs to happen more than one time in order for folks to see the benefit of doing that.
I'm gonna riff off of that if I can, Allison. I think
Yeah.
it's a really interesting piece because it's so linked to people recognizing and identifying themselves as a caregiver. And depending on Roxanne, I don't know if you're at the hospital or if you're at the family health team, but it's interesting, right? Because when you think about the continuum of care, if it's a complex patient, they're at a lot of different touch points in the health system. And I think that there's a lot that gets lost in that. because you may only be seeing them once or twice, or and so building that kind of introduction and trying to, it's the same thing with self-management, right? If you kind of got to get through the stages of change, but it's very difficult because you're focused on the patient, the person that's there, and so that can sometimes get lost. And so I don't think that there's a quick answer for that, Roxanne, certainly. Linking it back to primary care, assuming the person is attached, right, to a comprehensive primary care. It's one of those things that we don't have that kind of permission almost, I think, as healthcare professionals around, oh, you can kind of flag in the discharge summary as well of like, hey, I think their caregiver might need some support. And it's not part of the culture yet. And so I think that's something for us all to be thinking about. The only other practical thing that comes to mind, and I don't know for the OCO team, sometimes if you because I think you guys have some videos, but I've seen it done in different interventions where it's like, oh, just watch this quick video, and it might just be like 30 minutes, 1 minute. It's just something you can they can pick up with their phone, and it's a caregiver talking about how much they didn't realize they needed the support, or something that just, because you're not going to be able to bring them all the way through the stages of change, but something that just gets it outside of just you talking to them, especially if it's going to just be a quick exchange, you're not necessarily going to see them again, but something that just opens their mind to thinking about it. And then, there's sort of is that hope that eventually, as they keep going through the system, that um that it keeps coming up and there's more of that willingness. So you don't always have to have all the answers. I think having one or two things in your back pocket of, and I think just video is helping more people now. I guess it depends also on the age of the caregiver you're talking about. Um, and so I don't know if that's helpful, but certainly it does raise a really important opportunity, but barrier in the way that we think about supporting caregivers. And it goes back to that point that I made around the economics around this are really important. And I think politicians and planners are starting to better appreciate that. Like if you suddenly took all those caregivers out of the system, our health system would collapse even more than it already is in some respect, right? So we do have to solve for it in a more deliberate way, I think, thinking across the continuum and how we open some more doors in terms of thinking about how we communicate between providers around the caregiver, not just the patient.
I can't help myself, Jess. I'm going to jump on what you said because I think that there's this space between moving to a culture that normalizes supporting caregivers and doing this. But the steps to get there sometimes need to be with intention and formality, because it represents a change in practice and a change in how we're doing things now. And that can sometimes be a bit messy or uncomfortable, or we haven't gotten it down right. Right? We haven't gotten the language right to help folks identify or to include people in a conversation where it more easily connects them with the supports that they need in order to make that happen. So I think that this is where we're in this kind of messy middle of helping organizations and our health system recognize that piece.
Yeah.
And in doing that, what are those kind of key levers that we can do to formally build that infrastructure to get there?
Yeah, no, I completely agree with you. I think it's an interesting conversation for us to continue having. And this might actually be one of those areas where some of our smaller communities are at an advantage because they're, I can even think of like Aurelia. There's other places where there's such a strong connection between, let's say, in this case, the family health team in the hospital. Even at Montfort, you might have that, Roxanne, with, most of the patients might actually be at Montfort, but because then you could be like, call them up and say, hey, I saw this patient, and there's that sort of informality there. But to your point, that's so dependent on that one individual having a relationship over here with that other provider. And so that might be the starting point, but be thinking about how we can build some of that in more formally, like a section on the discharge summary that says something about caregiver support, right? Yeah, very interesting.
Thank you. Thank you both. I don't see any other question, but I'm gonna give it a minute to see if anybody else has a question before we proceed with the next slide. Mhm. Okay, well, thank you so much. So we're gonna go to the next slide. Thank you for all of you for joining us today. Special thanks to Jess Rogers and Nancy Ewen for joining us today. Really, really great material. And as I said earlier, we do have the session being recorded. So even if you couldn't make it to the entire session, we will have it sent out as a video and the slides as a PDF in a later email. I would really appreciate if everybody could please take a moment to do the survey, which Alton just shared. This will help us, just do a feedback on and help us plan our next sessions. And so without further ado, thank you all and have a great rest of your afternoons.